Watch TV, promoting sustainable development.
This is Health Moments, and I'm your host, Dr. Araba Odum. Here we discuss everything health, everything that has to do with the patient, that has to do with the patient's relative, that has to do with the health worker, and even the supporting staff being the health administration. We are here to discuss your concerns because they are also our concerns. This show is sponsored by Senvast, and you can follow us on our YouTube channel, our Facebook channel, our IG channel, and our Twitter channel at Watch TV channel. Today we are discussing self-medication, and before we come back to our resource person, we would like to go to the streets to find out what they have to tell us.
What do you do when you are sick?
I take meds.
You taking
Meds.
taking medicine. Okay. Is it prescribed medicine or you just taking something?
So it depends.
Okay. Do you go to the hospital?
Me personally, I don't like going to the hospital.
Why?
It's a waste of time since there's a pharmacy around, then I can go there instead of going to the hospital, and it might take a lot of time.
How do you get information about how to prevent yourself from certain kind of diseases and all that?
Normally, I Google.
You Google.
Yeah. Someone is sick. You won't just sit in the house and expect yourself to be fine while doing nothing. First of all, you have to go to the hospital, check up what's wrong with you before you can take any other measures.
Okay.
To be sincere with you, I don't remember the last time I felt sick or I visited hospital, but I can assure you, anytime I feel something uncomfortable within me, I report to the appropriate institution who can see to that situation.
Welcome back. We've heard what the streets have said. Today we are on the panel with Dr. Markin. He is a pharmacist, a doctor of pharmacy. So Dr. Markin, welcome today.
Thank you.
All right, Dr. Markin, so today we are talking about over-the-counter medications. And I would like to ask you how you would explain to me and to everyone what we mean by over-the-counter medications.
All right, so first of all, thank you so much for this opportunity. I'm very happy to be here.
You're welcome.
So simply put, there's OTC medications, or over-the-counter medications as you put it, is basically any medication you can sell to the patient without a prescription.
Okay.
Most of the time, these OTCs are used for issues of common occurrence.
Okay.
Things like headache, constipation, diarrhea. Yeah, so basically, those line of medications that are used for treatment of such conditions are what you would commonly refer to as OTC medications.
Okay. Well, so these medications, I presume you can just walk to the pharmacy and just go and get them, okay, by telling, okay, pharmacist, I have this, and then the medication is given to me, right?
Yes, most of the time that's the case.
Okay, all right then. But then, can you explain to us briefly the concepts behind over-the-counter medications? Because, I mean, when everybody hears over-the-counter medications, for example, I've heard people who say, oh, pharmacy now 𝐒𝐞𝐥𝐟, like when you go to the pharmacy to go and collect medication and sometimes they give you the wrong medication. Do you think it was the concept of it was bad in itself, or it's good, or there's any, so what's the concept behind the over-the-counter medications?
All right, so there are two sides to it.
Okay.
The first side, of course, it's good because it can help care about a lot of issues relating to, you know, the whole guiding principle is that not every single thing that happens to you would require you to go to the hospital. And if you do that all the time, you're actually going to be very frustrated. Imagine going to the hospital just because you have a headache. Although that doesn't mean that if you have a headache, it's not something worth going to the hospital for. But then first and foremost, you always need first aid. So that is the concept for OTC medications. They are mainly for first aid purposes. But then the other side of it is that people tend to oversimplify it just in that regard, that if I have a headache, it's nothing big. But then the most important thing to note is that it's only for first aid basis. That is why you can walk to the pharmacy to request for OTC medications. Of course, if you get the medication and then you take it and then there is no improvement, then certainly you would have to be referred to the hospital for further investigation and the like.
All right. How would the patient, or let's say the person who works at the pharmacy, know that, oh, this medication is exactly what I've gotten for my ailment?
So it will depend on the pharmacist, whoever is dispensing medication. The person has to do due diligence. If someone comes to you and has a complaint or wishes to get a particular medication, you would have to be responsible enough to give out the right medication for the right condition. But then one thing that I would also advocate for is that you as a patient, you as the one taking the medication, should be duly informed. And that is the most important thing. You don't just have to just pick the medication, whatever is given to you, but you have to know what has been given to you. Because if you don't know about it, it can also contribute to the issue of all these common issues of patients taking wrong medications for their complaints or issues that they are facing.
Okay, all right. So the over-the-counter medications, are they medications that are like easy to use, easy to follow for the layperson, or some of them seem a little complicated to me?
Yes, some are complicated. Most of them are easy. There are some technicalities in between, but then, like I said, it's very dependent. It's the responsibility of the person giving out the medication to give as much information about the condition or about the medication as possible, and and also dependent on the patient to also know or also be willing to listen to the advice that is being given to you. There are a number of issues, well, in my experience, there are a number of issues that have occurred where a patient will walk into the pharmacy for medication, has probably seen it on TV or has been recommended by someone else. That's the person took it for his headache, person took it for his diarrhea, and it helped him or her, so he's recommending it for you for the same issue. That's not always the case, because there are some things we call contraindications. That means that if you are someone that has a certain condition, if someone that has a certain issue already as a person, you taking this particular medication may end up harming you. I mean, doing more harm than good for you. So, well, let me just state an example for everyone to maybe properly appreciate it. So we know in our communities there are lots of people that are asthmatics. There are some people that are asthmatics. In this case, if you are an asthmatic, there are some medications that are contraindicated for you as a person. That means that if you are asthmatic, there are some medications that if you take, it can worsen your condition.
Yes.
So if someone recommends a particular medication for you and then it's contraindicated for you, you going to the pharmacy, first of all, you need to be informed. I'm asthmatic. I know that this is contraindicated for me. And then the person dealing the medication out to you should also be able to ask certain questions to find out to get a clear understanding of what is going on. Because if the person gives you wrong medication that's contraindicated for you, it can actually cause more harm than good, like we are all saying over here.
All right, thank you very much. Can you briefly list out maybe some of the benefits that have been linked to appropriate self-medication? Let me put it like that, because for me, what I've seen is it gives you an easy access of relief. You understand? You have a headache, before you even present to the hospital, you take maybe paracetamol or diclofenac, and then the headache subsides. You can later present to the hospital. So I know one of the benefits, it gives you quick relief. Can you give out any more benefits for?
Yes, certainly. Well, as you said, it gives you quick relief. The second thing is that it saves you time.
Yes.
The stress of being in line. You know, right now with our health setting, there's a lot of pressure on our health facilities.
Yes.
So then it will be easier for all of us and then for you as well to be informed of what is actually going on. to be able to know that, okay, I have a headache, it's most likely because I'm stressed, most likely because I'm tired. And then you go to the pharmacy, you talk about the issue with the pharmacist, you both agree that, well, this is most likely the case, you get a medication and you're okay. The second thing is that once you've done that, it also saves you the time, like I've already mentioned, of queuing, going to see the doctor just for the doctor to give you the same medication that could have been given to you in the pharmacy. Yes. So then those are the main benefits for being able to be informed and also knowing the right avenues to use. Because as an individual, you should always know that if anything happens to you, the first point of call is to seek first aid. And then seeking first aid, you can easily walk to the community pharmacy to have easy access to medications of that sort. But then notwithstanding, if you have any symptom or any issue that you are dealing with and you suspect or you feel like it's a problem for you, almost always try to seek medical advice first. Most of the time, the mistake we make is that we just, and again, something like headaches, we just assume that a headache is simple. Yes, but then there are a number of issues that can cause headaches. So, I mean, you're a doctor, most of people, we term it as differential diagnosis. So there are a lot of disease conditions that can manifest as headaches first. So it's important to know that most of the things that you feel are simple, like constipation, like diarrhea, headache, pain in your ears, they are simple, but then it's always worth noting that there could be something more. So as much as possible, seek for a professional opinion first before you go ahead with what we want to do.
Yeah, I mean, one thing I personally do, you know how some of your friends will call you, oh, they were feeling this way, they went to the pharmacy to get medications, then they'll send you a picture of all the medications they were given. So one thing I normally do is I go through the medications, I mean, family and friends benefit. So I'll go through the medication and then let them know that, okay, it's fine, it's okay. If this one is not necessary, I'll tell you, okay, don't take this one, but then continue the rest. If your symptoms persist after 2 days, like we always hear in the adverts, persist after 2 days or 3 days, report to the hospital. We find out that most people don't do that. Why do you think that is?
Well, from my experience, most people don't do that because they don't see the need to. Yes, because some people have issues. Maybe without taking medications, it just resolves. So they just feel like, well, it wasn't a problem after all. But then what you might not know is that once it resolves, there's probably something deeper going on that at the end of the day would manifest into something much worse. So it's very common for people with hypertension, people with diabetes, these chronic illnesses. Once the first signs start popping up, and you don't do much about it, and then it goes away, you feel like, fine, it wasn't a problem after all, thank God. But then as time goes on, it starts becoming worse and worse and worse, and it gets to a point where it's very, very hard to manage or to be in control. Yes. So that's the main concern for me.
All right. Yes. Okay. So we've been talking to Dr. Markin. Now we are going to find out how the public opinion has been on over-the-counter medications. I mean, before we even started, you heard a little bit on how the public thinks about over-the-counter medications and why some of them don't even go to the hospital in the first place. So, Dr. Markin, what do you think the public education on over-the-counter medication has been so far? Do you think they have enough information based on what you've heard, or you think there's more work to be done?
Okay, all right. So, well, first of all, thank you again. Currently, public education concerning self-medication is poor. There's a lot more work to be done. From the interviews that were done, it seems to me that people feel that going to the drugstore, as they put it, when they go there, they have access to all of their healthcare needs, which isn't the case. Like we already mentioned, the pharmacy serves OTC medications, and then there are medications that are sold without the need for a prescription. But then in their minds, self-medication also involves the use of prescription medication, so which you need a prescription for. But then most of the time they don't have. So that becomes a big problem, because if you're not really conversant with the issue of self-medication, you tend to abuse it.
Yeah.
And that is the big problem that we have concerning that.
Okay, so this lady we heard who was saying that, for her, if she has a headache or abdominal pain, it's strictly pharmacy or drugstore. But then when she has an issue with her eye, then she'll go to the hospital. What can you say to this lady?
Yes, so I mean, it's understandable, because the perception is that if I have a headache, it's common. It's not something is a big deal. I have something with my eye, it doesn't really happen all the time, so it's strange. Yeah. So that one needs more attention. So that's it. I mean, if you think about it, it's common sense. But then, like we are saying, it's not always the case. Chances are
it's worse than
it's worse than it actually already is.
Yeah.
So then, my advice to whoever or to the lady would be, first of all, when you go to the pharmacy, seek professional opinion. Speak to a pharmacist. If you have access to a doctor, speak to a doctor. Just explain what you have, what has been happening to you over the last period, or over the preceding days prior to what you're experiencing now. So the person can give you an informed opinion. If it's something that you would need to go to the hospital for, certainly you would have to go. If it's something that it can be solved in the pharmacy, it should be solved. The second thing is that people are afraid of going to the hospital because they are afraid they'll spend a lot more money.
Yes.
It's to go and pay consultation for a doctor, to go and pay for labs, to go to the pharmacy to pay for medication again. So it's like they feel like the shortcut would be just go to the pharmacy and then get all of your health needs there, which most of the time will not be the case, because the pharmacist there is not trained to be an all-rounder for your health needs. You understand? So then, yes, it's a big problem on that end.
Okay. In this era of evidence-based medicine, where it is advised, you do a test, you find out the evidence, like this actually what is wrong with the patient, or the test results point you to something that's wrong with the patient before you give medication. In this era of that, do you think it's contradicting the concept of self-medication, or is just, let's say, an adjunct, or the self-medication is an adjunct? So which is which?
Evidence-based medicine, in my professional experience, is the best way to go.
Yes.
Self-medication, like I said, it's the concept that is being misinterpreted. Self-medication is only meant for first aid treatment. But then in actual sense, with everything that is to be given to you, there needs to be evidence to back it.
Yes.
If you don't do that, you end up spending more. It doesn't make sense, but let me try and explain. If someone comes with an infection, maybe has been coughing for a very long time, has an infection in the lungs, and then goes to the pharmacy. You go to the pharmacy with your complaints. The pharmacist, in his professional experience, would say, okay, you have pneumonia. I'll give you this antibiotic, and then this painkiller, or this cough syrup, and then you take it. You go, and then nothing works. Then you have to come back to the pharmacy again, and now the pharmacist will say, okay, go to the hospital. Now you go to the hospital, they run the appropriate labs, they find out what medication would be the best for you, and then you take it, and now the medication goes. What's happened is that you paid in the pharmacy, you paid for medication for the first time, it didn't work, and then from there you went to the hospital, you paid again, and now it worked. That means that you wasted money the first time, essentially. Exactly. But meanwhile, you could have just gone to the pharmacy street. I mean, the hospital straight away, done the labs, taking the right medication, and then that was the end of it. So then, if you don't appreciate evidence-based approach, you would end up losing a lot more money than you think you had. So then, that's the thing. Most people don't think about it that way, but they just feel like if I go to the pharmacy, I mean, it's better than going to the hospital. But then, in actual sense, it is not. Okay, it's not.
I mean, when I think about it, I feel there's an underlying cause for every symptom that manifests. So if you're having a headache, there's obviously an underlying cause. If you have an abdominal pain, there's obviously an underlying cause. So I agree with you on the evidence-based medicine. I mean, you can take the over-the-counter medication and for the moment your symptoms are relieved, so you feel you are okay. But don't just stop there. If you get the time, go for regular checks. Just like I always tell my patients, go for regular checks, because that will tell you, oh, you are healthy, you are not healthy. At least you have the evidence that you are okay. All right. So the public education, you are saying that you don't think the education has been enough yet. What is your idea concerning the herbal preparations that we hear of these days? I mean, when you take a public transport, there's like 15 minutes at the beginning of your journey, there's like 15 minutes of a sermon on herbal medication, you know, how this tea can heal all diseases. I can share with you an encounter I had on the bus once. This guy was talking about the herbal preparation, that it's, after telling us all the things he can do, he now said it's not good for pregnant women. And then he goes ahead to say that about when a pregnant woman is in labor and then the baby is not coming out, the person can take the medication. And then I raise my head and I go like, wait, the person who is delivering is still not pregnant? And then everybody tends to look at me as if I've said something wrong. But then it goes to show that it is really not every medication that can heal all diseases. Because, I mean, this man was obviously contradicting himself. But then in the end, people were still buying the medication despite the question I raised. So it means they didn't really see the importance of my question. So what do you have to say concerning this herbal preparation, the fact that they heal all diseases?
Okay, so, well, first of all, I think everyone should just know that there's no medication that can heal every single disease.
Of course.
That's not how it works. So the thing, herbal medications, they are good, but then there's always the catch. It's good only if there's evidence that it works. That's the most important thing. If you are telling me that this medication can help with whatever I'm going through, there should be evidence to show that yes, this is the case. Yes. Because that is what the medications in the pharmacy, that's what they do. If they come out with the medication, they give you evidence to show that yes, I'm saying that this medication helps with your pain.
Yes, they've been clinical trials.
Exactly.
Yes.
So then it is tried and tested.
Yes.
If you come to me with herbal medication, there has to be trials and tests, and that's what most of the herbal preparations here aren't going through. They are only selling it based off of testimonies. So that's basically what it's about. Yes. When you go to when you're in the bus, you are listening to these stories, you'll just say, I knew a man, he was here, he had low sperm count, he had back pain, it was never going, but then I told him, try this, and then 3 days later he came to thank me and he gave me 5,000 Ghana cedis. Like it's all based on testimonies. Yes. But then there's never trials, there's never tests. And that's the reason why, as a professional, I would not recommend that take this herbal preparation whilst I know nothing of the tests and the trials that has been to. Yes. I will only feel confident in my professional capacity if I know that there's evidence backing it, and I know that and me knowing that I can have the confidence to say, take this, it will help you.
I mean, the reason why they do all these trials and tests is so that they can also tell you, if you take this medication, there are side effects, this is how to go about it. But then these herbal preparations, I've never heard of any herbal preparation that somebody will say, oh, expect this side effect and then this is how to go about it. Most times it's just, it solves this issue and then that's it. Yes. So
I would like to add, most people don't know that majority of the medications that are in the pharmacy are taken from herbal or herbs. Yes. For example, Coartem, I think the most popular anti-malarial we know, is actually from a herb. The thing is that that particular chemical has been extracted from the herb that's maybe what, like, it has been extracted from the herb,
Yes.
has been singled out as this is what would help with the malaria.
Yes.
And then we have put it in the tablets for you.
Tablets for-
Yes, most people don't appreciate that most of the medications we have right now are actually from herbs. The difference between the herbal products and these drugs is trials and then tests.
Yes.
That's the only difference
Yes.
between the two.
Yes, and if I'm not wrong, I believe that most of these herbs, the concentrations are done in such a way that it will not affect other body functions. Because I've had incidents where patients came to me, they took this particular herbal preparation, and then they come with their kidneys failing because the concentration of the medications they took were absurd.
Yes.
So I believe that if the public is really educated on where over-the-counter medications are from, herbs just like what they want to take, but then these concentrations have been tailor-made to be body-friendly, I believe that most of them will understand why they have to go to the hospital, why they have to go to the pharmacy for the actual medications.
You're absolutely right. You're absolutely right.
All right.
The thing is that most of these herbal preparations, like you said, because of the high concentrations, it causes a huge burden on your kidneys and
liver.
on your liver.
Yeah.
And then you would realize that most of the issues that are relating to herbal medication come with kidney problems and the liver problems because of this same issue. So yes, you are definitely right on that.
All right. Coming back to the harmful effects of self-medication and all of that, we find out that most mothers, I mean, I have a personal experience, most mothers come to me with their children very sick, and you ask them, so what have you given to the child? And they go like, oh, Meto, this medication, and then I bought antibiotics. And most times I'm like, why is antibiotic part of your first line medications? And they go like, oh, nanse onya cough dia ebisimi bacteria na wato antibiotics amon. So Dr. Marking, I've heard a lot of things about antibiotic resistance. Can you share a little on that for us?
Okay. All right.
Okay, so first of all, just explain what they mean by antibiotic resistance, and then you can go ahead and explain.
Okay. Well, let me just say, before I get into what antimicrobial resistance is, let me just say that it's a very big problem, especially in today's world. If you look at the biggest issues we have globally, aside climate change, antimicrobial resistance is the next biggest thing. If something like this continues, certain things we feel are very, very simple, very, very hard for us later on down the line. I think that if I explain it, maybe you appreciate it more. But then the simplest explanation I would give for antimicrobial resistance is like, well, the word implies it. It's where microorganisms, or the microorganisms that cause diseases, are now resistant to medications used to fight against it. So to the microorganism, it's like a once bitten, twice shy kind of thing. So maybe let me just give an example. We know that in the past, we're treating malaria with quinine. So it's like whenever someone had malaria, you can give quinine and then the person will recover. But then in the mind of the antimicrobial, it's like every time I'm trying to cause harm to this person, you put quinine in the body and you kill me. Okay, now I'm going to fight back. I'm going to change myself in a way that quinine no longer work on me. And then once that happens, quinine will no longer be effective against malaria. So that's just the basic concept of it. It's like the organisms adapt when you are giving them, when you are using the treatment on it, and over time you realize that the treatment becomes less effective. It's the same thing for sexually transmitted infections of late. Most people that have sexually transmitted infections, common ones like gonorrhea, will realize that once the first time you came, we gave you this antibiotic for the gonorrhea, it went. You have it again, but giving you the same antibiotic, but then it's not working now. the reason is antimicrobial resistance.
Okay.
So going back to what I said, that if you don't take care, things we feel are very simple now will be very, very difficult in the future. I was referring to this. If you have a disease condition now, like gonorrhea, and then I'm giving you an antibiotic, it's not working, that means that essentially we cannot treat gonorrhea anymore. And you can imagine how much of a problem that can be. So there'll be more deaths, there'll be more casualties, and things like that. So then that's basically what antimicrobial resistance is all about. I mean, in a nutshell, there are a lot more sectors around it. It's not just with human beings, but then we give medications to animals, and then that's the antimicrobial resistance in the animals can be transferred over to us actually, because we eat chicken, we eat meat, and all of those things. So there are a lot of areas concerning antimicrobial resistance that needs a lot of education about, but then in general, that's just a small aspect of what
I mean, even with me in practice, I've realized that a lot of cases of urinary tract infections, the antibiotics we used to give before, when we do a culture and sensitive, they come back resistant, and now it's like the most expensive antibiotics are the only ones that can fight that particular kind of bacteria that's causing the infection. So I think I really, really understand you. Can you please share a little bit of experiences from home or from the pharmacy where you've encountered someone maybe either overdosed on over-the-counter medication, or the person came back to show you a wrong medication from another pharmacy or another drugstore? Do you have any experiences of such?
Well, concerning antibiotics, I have a lot. What happens most of the time is that people want antibiotics in the pharmacy without a prescription. And unfortunately, most pharmacies, well, some pharmacies give out these antibiotics without prescriptions.
Okay, so not to cut you short, but ideally, that means if I want an antibiotic, I have to come with a prescription.
Precisely.
So antibiotics are not the routine over-the-counter medications?
Not at all. It's actually unlawful for you to give out an antibiotic without a prescription.
Okay.
Yes, in the eyes of the agencies that look after how we use medications in the country, it's against the law. There are certain exceptions, but then those are for extraordinary circumstances. But then most of the time, antibiotics are not meant to be treated as over-the-counter medications. Not in the least at all. It's a no. Because if we do that, it contributes to antimicrobial resistance. Because once people find out that you can easily go to the pharmacy and a request for antibiotics to be given to you, they tend to abuse it. And that abuse is what contributes more and more and more to antimicrobial resistance. And then for posterity's sake, it's going to affect us all. So for everyone, you should know that once you're abusing antibiotics, you're not doing it for you are not just affecting yourself. You're affecting your family, you're affecting every single person around you. You're affecting your parents, people that are very susceptible to infections, old aged individuals and the like,
the children,
and children most especially.
I was thinking of an experience I had in the hospital once, where a patient came and then she was telling me she had a flu, and then she went to buy a cough syrup. I think I remember coming to tell you even at the pharmacy that she said she got a cough syrup, and then a big bottle of cough syrup, she finished it in 2 days. And she was happily telling me she thinks she overdosed on the medication, and I'm like, she doesn't even see how serious that is. I think most people believe that, oh, how serious your symptoms are is how much medication you have to take. But they don't get that every medication has a set amount you have to take per time. So what do you have to say to the public about that?
Yeah, so again, you have to be informed. You have to be informed. It's all about education, because most people don't know what is good for them. It's sad to say, but that's the truth.
Yeah.
Especially if they don't have the technical insight into those kind of things. Because we are medical professionals, we know the dangers with overdose, we know the dangers with abusing medication, but then most people don't see it that way. I know for a fact there are some people that they feel if they take their medications more frequently than they should, they would experience relief faster.
Yes.
I've had issues where instead of taking 1 tablet twice daily, they voluntarily take 2 tablets twice daily because they feel like if I take it like that, the problem will be solved faster. But then that's not the case. That's why it's very important. Just follow the instruction. It's what is good for you. It's what we are trained for, and it's what that's why we are here to help you out.
I mean, sometimes I'm just dumbfounded at some of the things some patients say that, oh, I'm a for para. Like when I take para, it doesn't work for me. If I take 2 tablets, which is the 1 gram, it doesn't work for me. I have to take 6. How are you okay taking 6 tablets of paracetamol and you don't feel like you're overdosing on the medication? Do you understand?
Yes.
Sometimes I don't even know what to say to them in response.
You see, it's just the perception, because if they've taken 6 paracetamol tablets and they are alive,
I mean, you are right.
That's
yes,
happening
yes,
to them.
yes, you are right. I mean,
it's very important for them to know that medications can kill, but then it's just a matter of time. You can be taking 6 tablets of paracetamol, but you know that years along the line, you find yourself in a hospital bed with liver failure, and you know why. But then it's because of what you were doing. It's because that's the thing. It's consequences. If you are told to do something and you don't do it because you feel like it makes sense that you do it this way, the consequence will lie on you. So then it's all about just being informed, because your health, well, is your wealth. If you are healthy, you are better off. Most people would rather spend most of their hard-earned money on their health.
Yes.
Which isn't the best.
Yes, it isn't the best.
It's just best to just listen to your doctor or listen to your pharmacist.
Yes.
And then just live a good life.
Okay. So before we wrap up, I just want to find out, is it every drugstore that has like a pharmacist that knows all these things, or some of them is just dispense medications? Like, what's the difference between drugstore, pharmacy, or I don't know if I'm getting it right?
Okay, so as much as possible, according to the law, let me just put it this way, according to the law, every pharmacy should have a pharmacist.
Okay.
So if you walk into a pharmacy, first and foremost, request to see the pharmacist.
Okay.
If there's no pharmacist, it gives it should just tell you that you probably need to go and find another pharmacy.
Okay.
Because it's the pharmacist, the custodian of the medications.
Okay.
It's the pharmacist that has the professional conduct to know that this is good for you. Most pharmacies are businesses. Sometimes they tilt towards the side of making money more than looking out for what is best for you. So as much as possible, speak to a pharmacist.
Okay.
When you walk into any facility and you are looking for help, as much as possible, request for a pharmacist. If there isn't a pharmacist, you should probably find a facility that has one.
Okay.
Because chances are, if you seek opinions from people that you don't know, that aren't professionally are not in the right professional circles, you may do more harm to yourself than good. That is why most of the time in this current setting, people can easily go to pharmacies and get antibiotics, because the pharmacists are not in these facilities and they are not checking issues like this. Ideally, if you go to a pharmacy that has a pharmacist, the pharmacist would never give you an antibiotic without requesting for a prescription. The only time that can happen is if he or she has prior knowledge to what exactly is going on with you, and will give you the appropriate medication. And like I said, that is an extraordinary case. But then ideally antibiotics should be given only on the basis that you've shown a valid prescription.
Valid prescription. Valid prescription. All right. So let's say I couldn't go to the hospital in person, but then maybe I had a virtual consult. In this era of telemedication and all of that, yes, I had a virtual consult. The prescription was given me, maybe it was sent virtually. In that case, is it also a problem getting my medication over the counter, or it shouldn't be?
No, that is not a problem. It's a virtual consultation. The prescription was given to you virtually as well.
Okay.
So then it should still follow the same process.
Okay.
If the prescription is, whether it's virtual or written, it should be vetted and then shown that it's indeed a valid prescription.
Okay.
And then from there, the medication will be freely given to you.
All right.
All of these things are there to check people, or to check all of us, because if these checks aren't there, we will tend to abuse medications like this, and then in the long run it's going to affect all of us as people, because of the issues of antimicrobial resistance, and also the issue of wrong medications, and the issue of adverse effects relating to said medications as well.
Have you ever had an encounter where clients came to the pharmacy and you finished giving them the medications you are allowed to give the clients, and then it goes like, oh, why didn't you add an antibiotic to it? It's not me antibiotic. So how do you deal with such a person?
Well, first and foremost, I would educate you. I would let you know that what you are suffering from wouldn't need antibiotics. They would still insist, but then the most important thing is that you've tried to make them understand. Let me just give a personal example. I think there was this one evening where someone came to the pharmacy and then just mentioned that she had a stomach ache, and then she feels like she needs to clear her system, so she needs metronidazole, which is an antibiotic. And I asked her, but then what has she taken? She says, no, this happens like every 2 weeks. So every 2 weeks she takes metronidazole just to clear her system. So then for something like this, I had to sit her down and then educate her. It came with a lot of resistance, as in I would try to say something, she tried to give like a counter argument. It went like that for a while until eventually she realized that, well, what I'm saying is for her own good. Because I told her that, okay, look, if I was trying to lie to you, why would I lie to you? Because I can easily give you the medication and take your money. But then I know that if I do that, it's going to affect you.
Yes.
It's going to affect you in the long run. So I'm not here just for your money. I'm here for your well-being.
Yes.
And I know that this is bad for you. That's why I'm advising you against it. You understand? And then I think from there she started to warm up to the idea that yes, you don't need something like that for cleansing your system. And then so that this has happened because she has gone to other facilities, and then she has been given the medication without questioning, and then she believes that it happens across board. So then probably it's likely that the facility she went to didn't have a pharmacist to question her request. Why do you need metronidazole? What do you want to use it for? So then that didn't happen. So then she came assuming that I would also give with no questions asked. And when I asked my questions, I found out that she was using it for completely wrong reasons.
Yes.
So then I had to educate her.
Yes.
So that was that.
I mean, I've also had a similar encounter with a patient that came to my consulting room. I think he went to see another health professional. I don't know which facility it was, but then the long and short of the matter is the problem she came to me with. She said she went somewhere else. She was given some medications, and she hasn't seen any improvements. So she had a sore on her leg, okay, and it wasn't improving. I asked her if she was diabetic. She said she didn't know. So we ran some tests and realized that her sugar was really high, which proved that she was a diabetic. The person she went to see earlier did not do any tests because she complained of leg pain. I don't know whether he saw the sore, he didn't see it, I cannot see. But then when I asked for the medications that she was given, she said the person sent her to a pharmacy where they sell some particular drugs. And when you see it, you see that it's all these Indian medications, but then none of them were for either diabetes or for the fact that she has a sore on her leg. the medications were for arthritis, multivitamins, and all of that. I mean, the medications in itself were not going to harm the patient, but then they weren't going to solve her problem either. Yes. So in cases like this, I believe that if the public has an understanding, they will know exactly which medications are okay for them. They will vet every medication that they are given. Of course, for this woman, I don't know how else she would have, because I mean, she went to a health facility for the medications. So I just probed a little further, tried to find out which facility, tried to reach the doctor and all of that. Then I queried the doctor to find out, exactly, I'm not sure whether it was a doctor or I wasn't sure exactly, but then I know it was a health professional, whether a PA or a doctor, one of the two. So I asked the person why he gave these medications and all of that. But then upon further question and all of that, I later found out that, he has a link with the people who are supplying that medication. So and I was like, this is so wrong. I mean, where are the checks and then the balance? Who is vetting the way this patient is being managed in the hospital? Because you can't just do that. You can't just give the patient any medication that. So I believe that if we educate the public correctly, and then they go a further step by vetting every medication they are given, I think a lot of these things will be prevented. I mean, the patients ended up wasting so much money only to come and start all over again. So yes, I agree with you that the education also goes a long way to help.
Yeah, I would like to add that it's also important that as professionals we have to uphold integrity.
Yes.
Because, well, yes, we are in a profession. We are supposed to get paid.
Yes.
But then it shouldn't be about greed. We are in a profession to save lives. We are in a profession to take care of our patients. So then you have to have integrity.
Yes.
In order to uphold and then work towards that. So in this scenario that you have given, it's likely the person was just looking out for the money that the supplier is going to give him or her. Meanwhile, he just overlooked the benefit of the person getting the right medications to help solve his or her problems. So that's also very important. As much as we are educating the people, we should, as much as possible, try to remind ourselves why we are in this profession, why we are doing what we are doing. It's not just about money. Just not about money.
Yes.
So,
okay, so we will be back shortly, and then we'll wrap up this conversation that we are having on self-medication and over-the-counter medication. We will see you shortly.
I'm inviting you all to keep watching Watch TV. Watch TV is promoting sustainable development in Ghana and the world at large. So keep watching Watch TV.
Welcome back once again. We are almost done with today's discussion. And before we go, we would like Dr. Markin to give us his final words for today.
all right, so I'll just want to leave all of us with one thing I as much as possible advocate for, which is be informed. Be informed. Know every single thing that you are taking, every single thing you have been prescribed for. Most people, when they go to the consulting room or they speak to a professional, they are shy. It's either that or they feel like once I'm in front of a professional, I mean, all of my problems are solved. But it's not just that. Just be informed. Ask as much questions as possible. Whatever you are doubtful about, ask. Whatever the doctor is prescribing for you, ask. What is this for? You prescribed 5 medications. What will this do? What will this do? Like, you have to be informed. Be interested in your health. Because that's that's the most important thing. Because if you're able to do that, the more you be educated, and then the more you be able to take care of your own self. Your health is your responsibility, and it's also the responsibility of whoever is taking care of you to do that as well. Majority of it rests on you. What you have been prescribed for, if you wouldn't be free of your issues if you don't take the medication. So then majority of the responsibility would rest on you, the individual that is not feeling well. So as much as possible, I would advocate that every single person would be informed, that at the end of this discussion, the take home would be informed of every single thing concerning your health. So that's what I would really want everyone to appreciate before.
All right. And before we go, I would also like to add that as much as you've gone to the pharmacist for your medications, if you still have some when you're presenting to the consulting room later, please come along with your medications, because it will inform the doctor on what to do next. He might either prescribe the same medication for you, or he might change it knowing that, oh, this one didn't work for you initially. All right. We are so grateful you joined us for today's discourse. And as we go, as usual, follow us on our YouTube channel, our IG channel, and our Facebook channel at Wash TV channel. Thank you very much and have a wonderful day.
Wash TV, promoting sustainable development.